because I think they do not talk that much about their products, but they talk about concepts, they talk about evidence-based data, and then they do not insist that their drug should be prescribed. They want that it should be prescribed, and I'm very grateful to form your team for being here, especially Mohsin. So we are hoping that Vitamin D Academy will achieve or exceed the heights that PSIM awards and other awards have taken. So what is the idea? Why Vitamin D Academy? I think we all know that vitamin D is the master vitamin, and especially the COVID has made us realize that how important it is. We want it to be prescribed, whichever brand is prescribed, it should be prescribed in Pakistan. Obviously, because it will decrease morbidity and mortality, not only from COVID, but also from so many other diseases like chest infections, like hypertension, diabetes, atherosclerotic disease like strokes, and these are all evidence-based that we have. So in Vitamin D Academy we are planning to develop and train in a comprehensive way about vitamin D to our doctors. And we want to develop dosing guidelines which will again be evidence-based, as Soumya just told you that we will be conducting a lot of research. The first research will be what is the optimum dose of vitamin D in a Pakistani population, and is it irrespective of the weight or irrespective of the age or sex. So we will be coming up with evidence-based guidelines, and the evidence will come obviously from a good clinical trial. So, and we are also initiate a national drive of research on vitamin D by holding vitamin D research awards, and inshallah our third annual conference we will be giving out those awards to the young doctors and students, and this will start with the medical universities, then trickle down to colleges, and then to hospitals and beyond. Vitamin D Academy was born on 1st April 2021. 1st April is not a very good day really because but this was a reality. This wasn't fooling anybody on the 1st April. So it's easy to remember the birthday of this very, very important initiative. That this was born in Governor House, a very rich child, and was delivered by Sabine, so it is a boy. During my talk about the vaccines, I said कि Sabine जो है ये कराची में माशाल्लाह जितने बच्चे डिलीवर करती हैं उनमें से 85% लड़के होते हैं। आज मैं सुबह नाश्ता कर रहा था तो 2 ख़वातीन आ गई मेरे पास। उन्होंने कहा जी वो आपने ये कहा था, तो हम तो इधर रहते हैं एंड KPK में, लेकिन उन कहाँ कितने पैसे लेंगी, कितने कहाँ? मैंने कहा जी मुझे तो नहीं पता। मैंने फिर शबीन से कार्ड मांग के उनको दिया। मैं कहा जी ये, तो अगर उनकी बच्ची होगी तो फिर मुझे नहीं पता क्या होगा। So this is the Governor Punjab, Chaudhry Mohammad Sarwar. He himself is taking vitamin D, and he is a very staunch supporter of so many good things that we do in science, but also of vitamin D. And he happens to be diabetic, hypertensive. I am revealing it because he has allowed me to do so. So he is benefiting a lot, and may Allah keep him safe, hearty and healthy to lead us and continue to give us support and leadership in whatever we do. Here we have, I think, all the top hierarchy of Farmigo there. As you can see, Qasim Saab is there himself, and Jamshed Saab, Mohsin, everybody was there which mattered in Governor House. So to start with, initially, it will be a course online, a course which can be online or virtual or in physical contact sessions, or it could be blended, hybrid type of thing. But ultimately our objective is what really I believe, that we will put together this academy and collaborate with my university, which is University of Health Sciences, and we will upgrade this thing to a diploma program, I think in the next couple of years, maybe 3 years, because the importance of vitamin D is ever increasing. So I think we must come up with 6 months diploma program, which of course will be accredited by Saima Chaudhary is sitting there. She is the best person to develop the curriculum, outcome-based curriculum, and we will have it on the in the weekends. So the crash courses for 6 months, just like what we are doing for medical journalism. Javed is doing the courses over the weekend. So after 6 months, we will be awarding diploma, inshallah. For a while, we started very humbly with because of the COVID. We had a blended sort of a learning session. The module 1 was physiology, epidemiology, deficiency. I was very lucky to be part of the faculty, and I was asked to talk about vitamin D and COVID-19, which I tried to do justice with this subject, about vitamin D levels. Now, vitamin D levels are very controversial. People say, the labs say that low, suboptimal, optimal, high, toxic. I don't know. I have yet to see anybody dying or suffering from vitamin D toxicity. So I don't know why we are so much concerned about it and why we want to scare people, because they will be spending a lot of money and keep on going their levels down. There is no need to do the level. Once you replace it, you replace it. God forbid if they take high doses, it's not going to be harmful in any way. So I think the labs and the PSIM will try that the labs, just take out the toxicity, because that gives an impression to the doctor, to the patient, that this vitamin can be toxic. There is no hypervitaminosis in vitamin D, unlike vitamin A. So role of vitamin D in musculoskeletal system was discussed by a professor of orthopedics, Dilavesa, very eminent professor. The role of vitamin D in endocrine system, again in diabetes and diabetes prevention, and role in immune system, because immune system is largely dependent on vitamin D. We all know, and Professor Little's study tells us that vitamin D is necessary to go intracellularly to the immune cells, especially helper T and suppressor T cells, to have the intracellular messaging system. So that is a very important vitamin as far as the immune system is concerned, because the conduction of the messages in the RNA or DNA cannot happen without vitamin D. Role of vitamin D in pregnancy, childbirth and postpartum, very important once again, because here we are dealing with 2 lives rather than 1, and both fetal benefits are there, and maternal benefits of course are there. Role of vitamin D in reproductive health, especially male reproduction, it has a very significant role. The module 3 consists of a renal system and its disorders. Of course, in end-stage renal disease, it becomes essential to give active form of vitamin D3. And this, as I just said, it's just the beginning. We are an infant, but we are hoping that this will become into a very tall adult very, very soon. This course, you can see that 135 participants, 75 in physical contact sessions and 60 with joined virtually. 11 leading facilitators, and already faculty names are there. 4 sessions and 12 credit hours awarded by University of Health Sciences. Here you can see that now is the time to give out these certificates. So we decided that we will not give out the certificates till we hold an exam. So all these participants are going to hold an exam at University of Health Sciences Examination Center on Sunday, and once they hold it, whoever passes will be then awarded certificates again by Governor Punjab, So immediate, in the immediate future, what we are planning a branch in Multan, and we want to go to KVK, Peshawar, and a branch in Rawalpindi and Islamabad, so we can increase our presence and awareness of the properties of vitamin D. Dosing guidelines, as I already said, are very, very important for us, especially in our population where I believe there should be no toxicity, but we will wait for the results. This is my just perception, but it needs to be tested in a controlled study which we are about to do. The factors associated with prescribing patterns of multivitamins amongst physicians in Pakistan, this research was already conducted, and you can see more than 55% of the physicians do not, or some very rarely prescribe multivitamins. 34% of physicians, 1/3 of the physicians were not aware of the dietary sources of minerals and vitamins. 42% of physicians do not base their prescription on the lab results. It's a knee-jerk thing. 72% of physicians prescribe oral form of vitamin D. Although injectable form is available, but oral form is preferred by the physicians, because I think it is also preferred by the end user, which is our public and patients. 60% of physicians either do not or sometimes discuss the side effects of multivitamin minerals with the patient. So in the crowded clinics, the counseling part goes off. Here you can see that we have developed a partnership with very prestigious organization called GAIN, Global Alliance for Improved Nutrition, and here you can see the signing in ceremony, which was again conducted virtually, and we tend to do a nutritional assessment study of a cohort of around 10,000 Pakistanis in collaboration with GAIN. Vitamin D research awards will be given out, inshallah, very, very soon, as I said, in our next 3rd international conference, which we are hoping to hold in Karachi, and we are praying for our brothers and families in Karachi that they stay safe and COVID leaves them alone, because right now Karachi obviously is not safe. Here you can see that this will be given to peer review papers, and also this will be given to students, so that there will be 2 or 3 categories. And also I think what lot of things will come your feedback through your feedback. All of you are requested because you people are much more aware of things than I am. So we will appreciate your feedback that how we should take this academy further. Thank you so much. Thank you so much, Prof.
Thank you, sir, for always leading from the front.